Hello everyone. Today we are going to talk about distribution. Distribution. There are three important topics in distribution. They include the apparent volume of distribution, second one is your plasma protein binding, and then your redistribution. All these three form important topics in distribution. So we'll first start with apparent volume of distribution. It is represented by ABD. Basically, this is a hypothetical volume. What I mean by that is it is an imaginary volume. Okay, and it mainly talks about uniform distribution of drug, uniform drug distribution throughout body at equal concentrations. Clear? And consuming and assuming that your whole body is one compartment, single compartment. Clear? So this is the definition of apparent volume of distribution and is usually calculated by the formula total amount of drug given by drug's plasma concentration. Fine. Now we will explain this with an example. Let us say this is a beaker. Okay, and in this beaker volume is 5 liters and we have added water. Okay, into this we have added fish food. This is fish food, and fish food we have added about 5 grams, 5 milligrams. Okay, 5 milligrams. So concentration is please 5 milligrams. We have added 5 liters. So concentration is 1 milligram per liter. So concentration first we have to calculate 5 milligram per 5 liter. This is 1 mg per liter. Yes. Then apparent volume of distribution is calculated by amount given, that is 5 milligrams, by plasma concentration, that is 1. So apparent 1 milligram per liter. So the apparent volume of distribution is 1 liter. Clear? Now let us take the same example. I have taken a beaker, added 5 liters, added same 5 milligrams of fish food. But here in this beaker there are no fish. Fish live, no fish. But here I have added huge number of fishes. So even though I have added 5 milligrams, my fish has eaten around 4 milligrams. 4 milligrams of fish food is eaten. So I am left with what? 1 milligram only here. Am I clear? Now, using the same formula, plasma concentration will be 1 milligram in 5 liters. This is 0.2 milligram per liter. Now, let us calculate ABD. It will be I have given 5 and 0.2 is the concentration. So, it is around 25 liters now. But did the beaker change? Did the beaker change? Did the amount of volume change? No. Did the amount of fluid changed? Only thing is based on, let us correlate this example to our body. Now consider this beaker as our body. This beaker is our body. Clear? And this fluid water is our blood, intravascular compartment. Fish is organs. Now and our fish food is drug. Now let us see. Now when we give drug, if the drug has the tendency to get deposited in the body, in the various organs, obviously apparent volume of distribution will be high. Am I clear with this? Now what are all the various factors which affect this? One such important thing is obviously affinity of the drug. Yes, affinity, tissue affinity of the drug. And even though it has tissue affinity and if it is lipid insoluble, do you think it is easy for the drug to enter? No. So lipid solubility of the drug. In the same way, with respect to patient, diseased conditions. Okay, these are most important parameters. Now, why is this important? Why are we learning this? First thing is, let us take example of a drug which has very high volume of distribution. One such example is your chloroquine. Okay, your chloroquine has very high apparent volume of distribution, mainly because it gets deposited in liver and retina. Chloroquine is basically an anti-malarial drug. and your majority of the drug must stay in the vascular compartment, but whatever we give is going to your liver and retina. So what we have to do is we have to give the drug in a fashion in loading dose, that is multiple initial doses or a huge dose must be given in the first attempt. Clear? Loading dose concept will be there. Clear? And then second problem is, let us take example of chloroquine only. A patient has consumed around 20 tablets of chloroquine. Now you know that chloroquine goes and deposits in your liver and retina. Do you think dialysis is useful now? No. Hemodialysis has no role in drugs who have high apparent volume of distribution. So what I mean by this high apparent volume of distribution, for any drug, high apparent volume of distribution, any drug whose AVD is more than 4 liters, we usually consider it as it is reaching the extravascular compartment. Clear? In the same way, if it is very high, like chloroquine, it has huge amount. There are certain drugs like that. One such is digoxin. Drugs with apparently with high apparent volume of distribution, they include digoxin, they include chloroquine, they include phenytoin. At least these three you have to remember. And this is the clinical significance of apparent volume of distribution. With this, we have finished one concept. Now, let us talk about plasma protein binding. This is our second concept in distribution. What happens is, whenever we use a drug, this drug reaches the vascular compartment. And after reaching vascular compartment, usually based on the chemical nature of the drug, it binds to certain plasma proteins. Clear? Two such important plasma proteins are albumin and alpha-1 acid glycoprotein. Albumin, basically all of your acidic drugs bind to albumin. Example of such drugs are your barbiturates, your NSAIDs, aspirin. Clear? Your sulfonamides. And alpha-1 acid glycoprotein, if the chemical structure of the drug is basic, it goes and binds to alpha-1 acid glycoprotein. Such examples include lignocaine and beta blockers. Now, why are we learning all this? Because what happens is, this plasma protein binding is features. This plasma protein binding is dynamic. Most important, what I mean by that is, in vascular compartment, drug can be free or drug can be bound to plasma protein based on the need. Okay, and this plasma protein binding helps us your external. Clear? It acts as a binding center and it acts as an external reservoir. And even a small change, let us say patient has hypoalbuminemia, and in certain diseased conditions like where there is hypoalbuminemia, your plasma concentration of the drug, hypoalbuminemia, your plasma concentration of the drug varies significantly. Clear? These are most important. Now, why are we learning this? Why are we learning the significance, clinical significance? First such thing is, usually more plasma protein binding, drug is restricted to vascular compartment usually. So, in a case of toxicity, hemodialysis may help. Clear? And plasma protein binding acts as a place of storage. And usually this drug stays in equilibrium. So drug plus plasma protein, this is something what you have to remember. Free drug as well as bound drug, they stay in equilibrium. Let us say if the free drug is utilized, the drug from plasma protein will be slowly released and the duration of action may differ. Okay, and one other problem is, dialysis may help, but when bound to plasma proteins, that is, I'm not talking about free drug, I'm talking about bound form. Bound drug, it is difficult to remove with dialysis. Clear? And certain drug interactions are also very important. Let us say two drugs are fighting for same place in albumin. Then what happens is, let us take example of aspirin and sulfonamide. They show if the concentration, bound drug, free drug concentration, if these drugs are fighting for the same site in the albumin, then there is always a chance of drug interactions. Clear? This forms the clinical significance. Now we will talk about redistribution. See, redistribution is a property mainly shown by more lipid-soluble drugs. What happens is, when we give the drug to the patient, because of high lipid solubility, more lipid solubility, drug gets accumulated in fats, fatty organs. Once its organ is brain, fatty organs with more blood supply first. So one such organ is brain. So drug goes and deposits in the brain. But later on, because of same, your fatty organs with less blood supply, like your adipose tissue. What happens? First, when drug is given, obviously it goes, because of its high lipid solubility, first it reaches brain and gets accumulated in the brain. But later on, when the drug is rotated, is distributed in the throughout the vascular compartment, throughout our body, less blood supply but more fatty organs like your adipose tissue gain importance, because of which drug usually comes out of the brain quite early. Let us take an example of thiopentone sodium. This is basically sodium. This is basically a anesthetic drug, general anesthesia drug. When it is given intravenously, it reaches brain first because it is fatty organ and it has huge blood supply. So your anesthesia will be attained fast. Anesthesia will be very rapid. But due to the property of redistribution, it goes and gets deposited in the adipose tissue later on. Clear? So, though anesthesia is rapid, termination of anesthesia is also rapid. Termination is also fast. With this, we have finished the redistribution. Thank you for patient listening.